Hi, all you mommies-to-be. Welcome to my channel. In this series, I'm going to walk you through pregnancy week by week. We'll talk about how your baby is growing, the changes your body is going through, what you might be feeling, what to expect at your next doctor's appointment, and ways to help you stay more comfortable. Basically, everything you need to be thinking about right now. We're going to cover it all. So stick around. You definitely won't want to miss this. Today, we're talking about week 5 of your pregnancy. At week 5, you've entered the second month, which means you have about 7 months to go. At this stage, your little embryo is about the size of an orange seed. It has a tiny head and a small tail, making it look a little like a tadpole, but inside, incredible things are happening. Your embryo is now developing all its major and minor body systems, like the digestive, circulatory, and nervous systems. He's forming a heart, lungs, and even a stomach. Among all these body systems, the first to become functional is the heart and blood vessels. Very soon, his heart will start beating, something you might even get to see on an ultrasound, usually around week 6. Another system that's beginning to form is the early nervous system. He's developing the neural tube, which will eventually become the brain and spinal cord. As for you, mama, you'll start to notice some changes in your body as pregnancy hormones increase. Some women begin to experience sore or enlarged breasts, and you may notice that your areola, that darker area around the nipple, becomes even darker. You might start noticing that you're feeling more tired than usual. That's totally common during early pregnancy. Though it can be frustrating to feel like you're dragging through the day, be kind to your body and let it rest. Give yourself extra time to sleep at night. And if you really need it, take that afternoon nap. Your changing hormones might also make you feel like you have to urinate more often. It can be a little inconvenient, especially in the middle of the night, but it's completely normal. Another thing you might notice, and this one might seem obvious, is a missed period. If you've been tracking your cycles, you'll probably notice right away if you're late. But for some women who haven't been keeping track, it's easy to miss. If you can, try to remember the first day of your last period. Your OB will use that date along with an ultrasound to help determine your due date. And if you're pretty sure about your last period date, there's a neat little trick you can use to estimate your possible due date yourself. So, if your last period was January 1st, your most likely due date would be October 8th, somewhere right around there. It's not exact, since months have different numbers of days, but it'll get you pretty close. Your OB will confirm your exact due date at your first appointment. Some doctors like to see you very early in pregnancy, while others prefer to wait a bit longer. Typically, we see moms around 6 weeks. That's when you can often see a heartbeat and get accurate measurements to pinpoint your due date. The best thing you can do is call your doctor as soon as you get that positive pregnancy test. Their office will help you set up your first prenatal appointment and guide you on what to do next. At your first appointment, your OB will take some time to ask you questions about your medical history. They'll ask about your family history, any past medical conditions, surgeries you've had, and any medications you're currently taking. All of these questions help your doctor understand how to best support you and your baby throughout your pregnancy. Around 5 weeks, you might start to notice some nausea and maybe even some vomiting. This is called morning sickness, and it's very common, affecting about 70 to 80% of women. Most women begin to experience it around 6 weeks. Be sure to take your prenatal vitamins every day. They're important for both you and your baby's health. And here's your tip for this week. Try to drink 6 8-ounce glasses of water a day. There are several good reasons to stay hydrated. Besides helping prevent dehydration and keeping you feeling well early in pregnancy, drinking plenty of water can actually help reduce morning sickness. It can also ease heartburn and indigestion later on. Staying hydrated is especially important because dehydration can sometimes trigger contractions, which could lead to premature delivery. So keep that water bottle close and keep sipping throughout the day. That about covers it for week 5 of your pregnancy. If you haven't already watched week 4, make sure to check it out. It's full of great information too. Thank you so much for watching, and I'll see you in the next week's update.